really is whether it's working. I appreciate the goodwill involved in doing the programs, but what you're hearing as a Member of Parliament, of course, is that it's not working necessarily.
I think we are in no doubt about the challenges of the rural health workforce. It is the highest priority of the division, the workforce division, and that's why we have a National Rural Health Commissioner who's online who might want to contribute to this if the committee would like.
Very welcome to answer that question if you're available. Can we check whether we can hear you? Oh, there we go.
Can you hear me?
We can, thank you very much.
Hello, I'm Ruth Stewart. I'm the National Rural Health Commissioner. And I'm sorry, in all of the negotiation about whether I was online or not, I missed I've lost track of the particular question that Senator McLaughlin is asking.
I was inquiring around retention and whether our current initiatives are working well enough.
So I suppose my answer is that there is no single silver bullet to solve the problem of workforce in rural and remote Australia. There are a number of responses that are being funded. Retention is more difficult in that, first of all, you have to get the practitioners to the community so that you can retain them. We know that the things that influence whether a given practitioner will stay on in a community relate to their preparedness to fulfil that role. For example, a general practitioner who has the skills that we now recognise to be a rural generalist is more likely to stay on in a rural community. We are investing heavily in the National Rural Generalist Program, which is seeing the rollout of training and the building of a whole program in support of rural generalists around Australia. My office has responsibility to oversee the implementation of the recommendations made by my predecessor in the role. I can talk on about that if that's answering your question, Senator.
Where would I go then to sort of measure success over the next couple of years?
I think the best way is to look at the feedback from it goes on a jurisdiction by jurisdiction matter, and I acknowledge that South Australia, we're hearing a lot of distress from rural communities in South Australia about their lack of access to healthcare. I think that the best way, I follow reports from each of the Rural Doctors Association in each state, and also I work closely with the National Rural Health Alliance, who monitor closely the representation in different communities across the nation of health professionals. I think, and also the Consumer Health Forum is another useful source. It can be, I find it challenging myself that there are some communities that have poor access to healthcare from whom we hear little, and others who have relatively better access from whom we hear a lot. And I seek to have an evidence-based approach to what the health workforce needs are in a given community.